People often think of children with cancer as having a number of difficulties, depression, post-traumatic stress, and so on. And in our research, we've actually found that the great majority of children are doing quite well, have low levels of distress, and actually display growth, i.e. improvement, finding of benefit in many areas of their life as a result of their cancer experience. The traumatic stress models it starts with an assumption of cancer as a traumatic event, and we think that that is an assumption that may not be true. The first issue is we assess children. We do not actually ask them about how they're doing in response to their experience of cancer. We ask them about events in their life that were significant to them, and then allow them to tell us about that and report on their functioning as a result of whatever they happen to identify as significant events in their life. In this way, we avoid the suggestion to them that their cancer experience has been traumatic or that it's just naturally something that would cause problems. And we find if we don't introduce our questioning in such a way as to suggest to them that they ought to be having problems, that they actually report that they're doing quite well. As a result of our research, I don't want to overlook or diminish the challenges and struggles of anybody, either any patient with cancer or their parent, because it is a major challenge, and there may be suffering involved. However, what we have found in looking at how both children and their families respond to this challenge is that it's an example of just an amazing human capacity to adjust to life challenges, and that most of our patients and families are doing quite well, and in fact, in some ways, their lives may be improved and their personal functioning may be improved as a result of their cancer experience.